folks. This afternoon's topic A, we're discussing excessive daytime napping in older adults. Okay, so here we go with today's discussion A. Please join me for today's discussion. Excessive daytime napping in older adults is strongly associated with underlying health issues and higher mortality risks, especially when naps are long, frequent, or occur in the morning. Below is a clear, structured breakdown you can use for caregiving or caregiver education, podcast, framing, or a quick what this means for families segment. What the research shows across multiple large studies, frequent or long daytime naps particularly morning naps, correlate with increased risk of death and many signal underlying disease. Researchers at Mass General Birmingham found that older adults who took long, frequent naps, especially in the morning, had a higher risk of death. A JAMA internal medicine study showed each extra hour of napping is 13% higher mortality risk. Each additional nap per day equals 7% higher mortality risk. Morning napping, 30% higher mortality risk. Morning nappers may have more severe underlying health issues, including chronic inflammation or cardiovascular strain. Excessive napping is linked to neurodegeneration, cardiovascular disease, and circadian disruption. Longer naps, 90 minutes, have been associated with adverse cardiovascular and diabetes outcomes, cognitive decline, and increased mortality. Why excessive napping matters. The study consistently suggests that napping itself isn't the problem, it's a signal. Excessive or morning napping may reflect sleep disorders, sleep apnea, REM sleep, or REM behavior disorder, neurodegenerative changes, early cognitive decline, cardiovascular disease. Metabolic dysfunction, chronic inflammation, poor nighttime sleep quality, Researchers emphasize that tracking nap patterns can help catch health issues early, especially when combined with wearable data. What families and caregivers should watch for. Red flags include new or increasing morning naps, naps longer than 60 to 90 minutes, multiple naps per day, a sudden change from a person's baseline, daytime sleepiness despite a full night's sleep. These patterns may indicate that an older adult's body is working harder than usual, whether due to infection, heart strain, cognitive changes, or sleep disruption. How to frame this for families, podcast or handout ready key messages. Short naps can be restorative, but when an older adult starts napping more often, earlier in the day, or for longer stretches, it's not just getting older. It can be the body's early warning system. Actionable steps. Track nap timing and duration for 1 to 2 weeks. Note changes in cognition, appetite, mobility, or mood. Ask a clinician about screening for sleep apnea, cardiovascular issues, or cognitive changes. Review medications that may cause sedation. Bottom line, excessive or morning napping in older adults is a clinically meaningful signal, not a harmless habit. It often reflects underlying health conditions and is consistently linked to higher mortality risk across multiple long-term studies. Guys, here's the second half. Short planned naps can help older adults, but long, frequent, or morning naps are repeatedly linked with worse health outcomes, including higher mortality and often signal underlying disease. Summary of the evidence. Prevalence and patterns. Daytime napping is common in older adults. Estimates 20 to 60% influenced by circadian changes, culture, illness, and medications. Health associations. Short naps, around 20 to 30 minutes, are often neutral or beneficial for alertness, while long naps, 90 minutes, frequent naps, and naps occurring in the morning are associated with adverse outcomes, including cardiovascular problems, cognitive decline, and increased all-cause mortality. Show stronger, more reliable links between nap timing, duration, and outcomes than self-report studies. What this means for clinicians, caregivers, and families. Treat excessive or new napping as a clinical signal, not just aging. Red flags. Sudden increase in napping, uh, in nap frequency. Naps 90 minutes, naps early in the morning, daytime sleepiness despite adequate night sleep, possible underlying causes to evaluate: sleep apnea, medication side effects, depression, infections, heart disease, and early neurodegenerative changes. Practical steps to take now. Track nap timing and duration for 1 to 2 weeks. Sleep diary or wearable. Review medications and recent health changes with a clinician. Screen for sleep disorders, sleep apnea, and cognitive changes when naps are long/frequent. Recommend short early afternoon naps. Limit to 20 to 30 minutes if restorative naps are desired. Evidence gaps and research notes. Most reviews call for longitudinal and interventional studies to determine causality and optimal nap doses, combining objective measures, actigraphy with clinical follow-up is recommended. Short planned naps, 20 to 30 minutes, can be beneficial for older adults. Alertness and learning, but long 90-minute frequent or morning naps are repeatedly linked with worse cardio, metabolic, cognitive, and mortality outcomes and should prompt clinical reviews. Key findings from the systematic review. Scope. The Frontiers systematic review pooled 15 studies total in approximate 326, examining nap frequency, duration, timing, and effects on subjective sleepiness, cognitive, psychomotor performance, nighttime sleep, and psychos, psychological measures. Net benefit on short-term outcomes across experimental nap studies. Daytime naps improved subjective sleepiness. Fatigue, psychomotor speed, accuracy, and some learning tasks. Risk associated with long, frequent morning naps. Observational literature links long naps, multiple naps per day, and morning naps with higher rates of cardiovascular disease, diabetes, cognitive decline, and increased all-cause mortality. Objective measures. Strengthen these associations. Nighttime sleep. The review found minimal consistent evidence that a single daytime nap harms nighttime sleep in older adults, though through chronic patterns need more, although chronic patterns need more study. Practical guidance for caregivers and clinicians. Track, record the napping time, duration, and frequency for 1 to 2 weeks. Sleep diary or wearable. Red flags. Onset of morning naps. 90 minutes. Multiple naps day or naps day or daytime sleepiness. Despite accurate night sleep. Evaluate. Review medications. Screen for sleep apnea, depression, infection, cardiovascular disease, and early cognitive impairment. When red flags appear, recommend if naps are Okay. So that is your A for today. I will see everybody for B shortly. Until then, Gator Wellness, take care, folks. Be back on with B shortly. Give me a bit for that, please.